The following program is sponsored by the Medicine Center Pharmacies.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and January Appraisals and Liquidations. And, of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our very special guests are Dr. Edward J. Walsh, M.D., Medical Director of Cleveland Clinic Mercy Hospital Cancer Center, and Dr. Alex Pancake, DDS, with Cleveland Clinic Mercy Hospital Dental Services. This morning, we'll be discussing oral cancer. Good morning, Dr. Walsh and Dr. Pancake, and welcome to the show.
Good morning.
Close to 54,000 Americans will be diagnosed with oral or oropharyngeal cancer this year. Oral cancer is particularly dangerous because in its early stages, it may not be noticed by the patient, as it can frequently prosper without producing pain or symptoms that they might readily recognize. The good news is that your physician or dentist, in many cases, can see or feel the precursor tissue changes or actual cancer while it's still very small or in its earliest stages. This reinforces the need for routine screening with your dentist or physician. This morning, we're going to talk with both Dr. Walsh and Dr. Pancake about oral cancers, discuss screenings, risk factors, diagnosis, and treatment.
So, Dr. Walsh, would you please introduce yourself to our listeners and explain your role and responsibilities at Cleveland Clinic Mercy Hospital Cancer Center?
Good morning. My primary responsibility is as a radiation oncologist using radiation treatments for various cancers, including head and neck cancers. We unfortunately get a fair amount of that here.
Wow.
And I also serve as the medical director of the Cancer Center currently.
And Dr. Pancake, please introduce yourself to our listeners and explain your role and responsibilities at Cleveland Clinic Mercy Hospital Dental Center.
I'm Dr. Alex Pancake with the Dental Services Department. In our department, we do everything from cleanings to fillings, which are simple procedures, to things such as implants, oral surgery, smile design. And we're also one of the first places that typically see cases of oral cancer because we work in the oral environment.
So, Dr. Walsh, what are some risk factors for oral cancer?
Well, traditionally, the main risk factors were smoking and alcohol, and they still are. Smoking itself can increase the risk by 5 to 25 times above a person who doesn't, a non-smoker, and alcohol about 6-fold increased risk. And it's definitely related to the amount of smoking and the amount of drinking. In other words, the more you imbibe, the more greater your risk is. Also, ill-fitting dentures that cause chronic irritation can lead to squamous cell cancers in non-smokers. And then the predominant cause we're seeing now is the HPV virus or human papillomavirus. And that began rising in the late 80s. And as the traditional head and neck cancers due to smoking and drinking have decreased with decreased smoking, the head and neck or oropharyngeal cancers due to HPV are on the rise, unfortunately.
Wow. So how about screenings for oral cancer? Do we have those?
Well, HPV is also a similar virus that causes cervical cancer, and actually through Pap smears to detect abnormal cells, or they can also do testing to actually detect the HPV virus. We don't have that for oral cancers yet. So the primary screening tool is really regular visits with your dentist, because they can give you a comprehensive look at things.
Okay. Once cancer is diagnosed, what is the treatment options that are available?
Well, unfortunately, most of at least the oropharyngeal cancers involve the tonsils or the base of tongue. So often they can grow before we're even able to see them, particularly the base of tongue. So patients will present with a lump in their neck, which could be just an infection or could be something worse. Often it doesn't resolve with antibiotics, and then they are referred to the ENT doctor. So surgery does not usually play as big a role as it used to. It's primarily either radiation alone or, in the more advanced stages, radiation plus chemotherapy. Some of the oral cancers in the front of the mouth are more amenable to surgery and may or may not need chemotherapy or radiation afterwards. But the bulk of them are treated with radiation or a combination of radiation and chemo.
All right, very interesting. So how about we talk about some side effects that can be expected during treatment?
Well, the side effects of radiation and chemo are pretty intense, particularly in folks with involvement of the neck nodes. We end up, treating the whole back of the mouth and then the throat. So after about 2 or 3 weeks, swallowing becomes pretty difficult. Often people need pain medication to get through the treatment. After about a week or so, your taste pretty well goes away. People say everything tastes like cardboard paste or a metallic taste. And we tend to dry out the watery part of your saliva, so you get kind of thick, gooey stuff that gathers in the back of the throat, and then you can get redness and irritation in the skin as well. Not fun. And having the radiation with chemo intensifies those effects a bit.
So let's talk about interventions that are used to help proactively manage some of these side effects that you just covered.
Well, a good pre-treatment dental evaluation is important. Also, we have various mouth rinses patients use to kind of keep the mouth clean and kind of soothe some of the side effects. There's oral medications we can give to kind of temporarily numb things when people try to eat. And then, as I said before, various pain medications to control pain and different creams or ointments to put on the skin to help with the skin irritation.
Okay. Yeah, we often see medications in the pharmacy come through for prescriptions for like compounded mouthwashes and things like that help people during those tough times. So it's amazing how we can all work together to help patients get through a really difficult time like that. Are there other factors that contribute to the rise in oral cancer incidence?
It's primarily the HPV infections are more widespread and common, and then that results in the increased incidence of the HPV-related head and neck cancer. So really the smoking and drinking head and neck cancers, it's maybe a couple a year, and the dominant ones we see are the HPV-related in younger people, 40 to 50 years old, non-smokers, non-drinkers.
So HPV, we heard a lot about HPV years ago when the vaccine first came out, and frankly, I wasn't thinking about HPV vaccinations related to oral cancer issues or issues like this. So can you speak to the importance of vaccination and what you as medical professionals have seen as the result of patients that have had the vaccine?
Well, in terms of recommendations, when it first came out, it was just recommended for girls, and then they, starting at about the age of 11, and then it was broadened to include males. Then they raised the age up to 26 years old, and now there's even consideration that it might benefit people up to 45 years old in selected cases. So ideally, you want to vaccinate people before they've had any intercourse, so to speak. But that doesn't mean it can't be effective later on down the road. in terms of the head and neck cancer, there's unfortunately can be a 10 to 15 year latent period before you develop a cancer. So it's really too soon to tell. There is, decreasing incidence of cervical cancer already there.
Gosh. So recommended guidelines for HPV vaccine. I guess what I'm asking for is the age, maybe.
Well, currently you can start as young as age 9. General recommendations is age 11 to 12 to start it up to the age of 26. And then it's also recently been approved for people up to the age of 45 after a discussion with your doctor, so regarding risks and benefits in that age group. The problem with an older person is they've probably already been exposed, so the vaccine doesn't necessarily treat cancer caused by HPV. The best route is to prevent ever getting a chronic infection to begin with the vaccination.
So what does Mercy offer, Cleveland Clinic Mercy Hospital offer to assist patients with oral cancer?
Well, Dr. Pankake could probably speak to this as well. We do regular oral screenings. The COVID-19 has somewhat put a dent in that, but I think it's starting to ramp back up again. Mm-hmm. And that would be the primary screening tool. And then during treatment, we have a lot of supportive services. We have the patient see a dietitian. We also have them see a speech therapist because the swallowing muscles also get treated when we treat these cancers. And so it's good to intervene early with that, even during treatment, to keep their swallowing function in good working order.
This is really an ugly disorder, isn't it? With once the mouth gets involved, and I would suspect that some of these people end up with not tube feeding necessarily, but like a TPN or something like that. Is that about right?
About a third of patients. It's very difficult to keep your hydration and nutrition up when your throat is sore, every time you swallow. So
sure.
At a minimum, folks have to switch to a pretty bland, softer liquid diet. And about a third of people do have to get a feeding tube, which goes through the skin of the abdomen directly in the stomach. TPN is not customarily used because there are issues with using that long term. And if we can use your own gut, so to speak, that's the best way to get people nutrition.
Wow. Okay, doctors, how about we take a break here, listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
COVID vaccine and flu vaccine also. So here we go. Let's get back to the show. Single most important thing that someone can do to reduce the risk of oral cancer.
Well,
I would guess it's smoking. Is that not smoking? Is it?
Yeah, for the older type head and neck cancer, which is maybe 15 to 20% cases now, it's quit smoking and alcohol in moderation. Yeah. And then for the HPV related, the primary best thing to do is to get vaccinated. The issue is that the younger the age, the better. So.
All right, Dr. Pancake, why would some patients visit their dentist before treatment for head and neck cancer?
Well, patients need to see their dentist beforehand because there are preventative measures that we can put into place beforehand before they get the therapy done that can end up leading to a better long-term prognosis. In this case, it includes getting on a good hygiene schedule. Typically, instead of going to the dentist every 6 months, we may want to see them every 3 to 4 months instead. Also, we can give them prescriptions for medicated toothpaste, which can help lower caries incidence. Really decide on which teeth need to stay in the mouth, which teeth need to come out of the mouth. Make sure we eliminate any active infections, which may lead to more problems down the road, either during therapy or after therapy. Another thing we can do for patients is we can make specialized fluoride trays so that at nighttime they can put these fluoride trays in and make sure their teeth are getting enough fluoride in them to make sure they're nice and hard and have the best chance to resist caries.
What about dental posts? Do they increase the risk of oral cancer in any way?
Do you mean like dental implants?
Yeah, implants, correct.
So implant surgeries, not necessarily. Beforehand, if you get them done before, it's not a bad idea. After you get head and neck radiation, though, your bone has a decreased healing capacity. Mm-hmm. So if we go in there and start throwing in implants, there's always a chance that there could be some necrosis due to the bone not being able to properly osseointegrate around the implant.
Sure. All right. What does a dentist look for when doing a cancer check on a patient?
The two main areas that somebody like me would look at would be that I'm looking at the outside of the face first, and then I'm going to look inside the mouth. So when I'm looking on the outside, I'm looking for any abnormal colorings, abnormal marks, asymmetry to the face, any just odd-looking tissue. And it's the same way in the oral cavity. I'm looking for the same kind of things. I want to check the salivary glands, the lymph nodes. I want to look at the tongue, the top of the mouth, the floor of the mouth, the cheeks, everything. See if there's anything that just doesn't look right. And your dentists are trained to be able to see. They see 99% normal tissue, so they can tell when something's out of the normal.
So I see a dentist regularly, okay, and they always do an oral cancer test. And what it is really just kind of swabbing the tongue or something? Is that how the oral cancer test is done? Or
there are some, if there is odd tissue, we can do something that's called a brush biopsy, where we just kind of put a little, essentially like a big Q-tip in the mouth and kind of wipe that around and see if any abnormal cells show up. There are other cancer detecting tools. There are some lights that actually shine, and if there's cancer in the mouth, it can change the cancer a different color. Now, the issue with these tests are they're not necessarily always the most accurate, so there are a lot of false positives. So still today, a regular biopsy of tissue is the gold standard for us.
What's a really thorough oral cancer test or screening?
A really thorough one would include mostly it's tactile on the outside of the face, so feeling for any lumps, bumps, hard tissue underneath the neck. If your dentist looks behind your ear, they could be looking for possible melanomas. If they are looking at your nose and stuff like that, they may be looking for any sort of basal cell carcinomas. Inside the mouth, they're going to probably ask you to stick out your tongue so that they can view the high-risk areas, such as the floor of the mouth, the sides of the tongue, the hard palate, and just feel those areas in general, and make sure that there's no abnormal to sight either.
Is there any typical area of the mouth where oral cancer can reside or can start to infect you, or is it untypical?
So our most common areas where we see them is usually the lateral border of the tongue, so the sides of the tongue, or the floor of the mouth. Occasionally we'll see them on the hard palate as well. Those are kind of the three biggies. Besides that, usually not too much on the cheeks or anything like that, though.
And in terms of the HPV-related cancer, that's base of tongue and tonsil, which can be difficult to see. We're not quite sure why HPV preferentially infects those areas, but those are basically the top two in terms of the HPV-related.
And would that not be difficult for the average dentist to see on the tonsil, or am I wrong there?
The tonsil, not so much. The base of tongue, yeah, that can be pretty hard.
Yeah, coming from our perspective, it is probably a lot harder to see back there on the base of the tongue. That would probably be more for somebody, an ENT, who is probably more trained to be able to look at that area.
Okay. Very interesting. Okay, it's bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass, ornaments, your Santas, jewelry. Come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We are talking with Dr. Edward Walsh and Dr. Alex Pancake about oral cancer. We've got a lot more to cover this morning, so let's get back to the show.
All right, let's talk about survival rates for head, neck, and oral cancers. What are the statistics?
So, from the information that we usually get is, in our general, what we're taught in dentistry is about 2/3 with detection is the survival rate we see. Back in the 90s, it kind of ranged between around 50%, but now it's up to 65%. And with early detection, it can be as high as 85% if it's caught early and is able to be getting rid of early.
Wow. Okay, so why is it important to get teeth fixed before chemo and radiation?
That's kind of a twofold question there. So number one, we need to get rid of active infection. Active infection either needs to be gotten rid of via root canal or an extraction. And the importance of that is because if you have to have either of those procedures done afterwards, there's just possible consequences such as infection with a root canal or removal of a tooth after head and neck radiation can cause osteoradionecrosis, which is like a worst-case scenario, just because you're going to end up probably losing some tissue there. Now, the other aspect is we want to have those cavities treated with traditional fillings, either composite or amalgam, because we want to be able to have nice sealed-off margins, and it will also keep cavities from getting any deeper than what they are, because after you have head and neck radiation, your cavity risk goes up tremendously due to decreased salivary function.
I had a friend once who did, in fact, have surgery after radiation, and it just simply would not heal. And this was in the early days of a revival of hyperbaric oxygen. And I don't know, I'm sure you're familiar with that. And it was interesting that it did resolve the problem for this man, and he was quite elderly. So,
hyperbaric oxygen treatment is still considered one of the gold standards post-radiation if we need to extract a tooth. I have several patients that I currently see that we they've already gone through hyperbaric oxygen treatment here at Mercy. There are other treatments coming out. Now there's a vitamin E and NSAID combination, which is showing promise instead of having to go in for those HBO therapies. But this is still in kind of a work, does it not work kind of way. One of the most important things is to look at dosimetry maps to see, are the teeth really been affected by radiation? Because a lot of times with these localized treatments, the teeth haven't necessarily received the radiation that you might think they have. So having those dosimetry maps really helps us tell, okay, do we need to be cautious with these teeth? Do we need to send them for hyperbaric oxygen, or do we feel more okay?
This was quite some time ago, like 25 or 30 years ago, and he went to another city, and they were using an old iron lung from the polio days, I think he told me, he said it really clanked and made a lot of noise, most people don't really know much about this, and I didn't really either, but put the entire body in the at that time in the lung or whatever they're doing nowadays. I'm not really sure, but it really was an interesting therapy. So what about the radiation therapy thing? What about the teeth and the gums, and how does that affect it? And, we've talked a little bit about this, but it really sort of messes up the gums, does it, and all that sort of thing?
Yeah, so I'll start with the teeth because I think it's a little easier for them. With the teeth, you see an increased propensity towards some sort of cavity. Just because the salivary flow is decreased, your saliva and the oral environment changes entirely. Your saliva becomes stickier, which allows for bacteria to stick to the teeth better. And because you don't have as much saliva, you lose your buffering capacity to buffer the acidic environment that bacteria produce. Now, what we see, and I think Dr. Walsh kind of alluded to it earlier, is that we see a lot of soreness in the soft tissue areas. You see redness, sloughing of the gums, ulcers, taste problems, trismus. Typically, they happen about 2 weeks. They start happening about 2 weeks after initial therapy, and we see this kind of peak effect about right at the last treatment of radiation. And usually after about 2 months after the last treatment, the tissue can start to get back to normal. And we do have treatments during that time, such as mouth rinses, and maybe some topical anesthetics to help out with the discomfort that comes from these treatments.
It seems like we have a mouthwash, it's saliva equivalent or something out there.
Yeah, there is a couple products out there that they do simulate saliva very well. It's because it contains glycerin, and it makes your mouth feel very moist. We use it for our dry mouth patients all the time up here.
Okay, what about this one? Does the patient need to have all their teeth removed if they need radiation, or some of them?
They definitely don't need all their teeth removed. They may require some of their teeth removed, though. So our general rule of thumb is that we want to get rid of any teeth that have a questionable to poor to hopeless prognosis, because we want to limit the amount of possible post-operative side effects from the radiation. So, no, you don't need to have all your teeth removed, but yes, some of them may need to come out if it's determined that it would be a long keep them.
I know we covered most of this, but are there some other things a patient could do after radiation therapy for their mouth to feel better other than what we talked about?
The big thing is staying hydrated. I tell all of my patients to drink plenty of water to keep their mouth moist. Always have a bottle of water on you to be able to swish around or something like that if you're getting dry. That also helps neutralize some of those acids. It also helps break, if you swish it around a little bit, helps break some of those sticky saliva off your teeth. We can use stuff like saliva substitutes, such as glycerin, to keep the mouth feeling nice and wet. There are also saliva stimulating activities that you can use to try and, if not all of the gland is gone. We have xylitol gum and lozenges you can chew on, which are sure they don't cause cavities. They'll actually stimulate salivary flow. You can also suck on xylitol hard candies, which can help out a lot. And there are things we can do. Another big thing is just to make sure that you're seeing your dentist regularly. Like I said before, we want to probably see you every 3 to 4 months instead of every 6 months to make sure there's no new cavities, or if there is a cavity, we can be aggressive with treatment.
Okay.
So what do I do if I already had radiation and now I have a tooth problem?
Well, biggest thing is don't just ignore it. You want to go see your dentist and be honest with them. Tell them about the symptoms. Tell them about what's going on. We want to know. The more information that you give us is the better. So after radiation, if you have a cavity, if it's just like a little something, we can do a filling there. We may need to do a crown or something. We could stay kind of conservative treatment. Sometimes there is a medication we can place if we can't place a cavity and we don't want to lose a tooth yet, called silver diamine fluoride. It's a staining material that actually arrests cavities. It does turn the teeth kind of black, though, but it is effective. If a traditional filling wouldn't work. With that, also, if a tooth is non-restorable, we have a couple options. We can go through that pre-medicated treatment, such as the hyperbaric oxygen, so that we could perform an extraction. Or we do some dentistry is awesome because we can do some really creative stuff. So one thing we can do if we're really afraid that somebody would have necrosis from treatment is we can do a root canal on a tooth and then cut the top of the tooth off and leave the bottom of the tooth as long as it's not chronically infected. And that would prevent us from having to take the tooth out while not having to risk, the osteonecrosis. And it would also allow us to be able to get rid of any sensitivity or issue that would be happening if it's some sort of chronic pain or something like that.
So if you take the top of the tooth off, doesn't that kind of screw up the bite? Maybe even mess up the jaw thing a little bit, or not?
It can definitely affect the bite. Yeah, this is kind of like a Hail Mary in football terms. This is saying, we're trying our best here. It could end up changing your bite, yes. But I've seen people with partial dentures where they've done this. We do this in healthy patients too. If we want to maintain the face morphology, we want there's certain teeth that give the face not a good shape. And sometimes we want to keep those roots in the bone. That way the face maintains that shape. So this has been practiced for, I've seen patients in their 80s have this. So this has been going on for years, and it's been quite successful in many cases. So we can do this fairly easily.
Okay, our final breaks here. You're listening to Health Matters at the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin, or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We have a few minutes left, and we have more than a few questions. So go ahead, Brad.
All right. Well, first off, before I ask my next question, I want to thank you both for what you do, and I appreciate it personally, especially from the dentist perspective, because my dentist a couple years back identified a lesion on my tongue, and I'm not a smoker or a tobacco person or anything like that. And, you know, much like we opened the segment with, if you don't get your regular checkups and get checked out and have your teeth cleaned, I don't know what would have happened. You know, it would have been something that would have gone unchecked until it would have been probably a bigger problem. So I encourage you all, if everyone listening, if you have not seen your dentist regularly, make an appointment after this program ends, because you need to be seen just for your oral health, not just to check teeth for cavities. That being said, can oral cancer come back, doctors?
Unfortunately, oral cancers can recur even if treated appropriately. One of the recent studies I've seen, but this is out of China, mind you, that recurrence rate for squamous cell, which is the most common oral cancer, which makes up 95% of the oral cancers that we see, the recurrence rate is about 32%. Now, this is just one study. Dr. Walsh might be able to go more into what he sees, but that's what we've kind of been taught throughout our training. And one of the best ways to prevent or identify recurrence is, like you said, come in, just get seen. You know, we're very friendly people, so we'd like to have you in the office. And it's a good way to, you know, identify it, because a lot of times there's little small lesions that we can identify when they're very early, and we can treat right away, and it can really prevent a lot of time in the end, because typically it might just be something small, maybe something not even that noticeable. But if a dentist notices it, it's a lot better that they notice it before you notice it, because by the time you notice it, it may have gotten to a point where it's going to require more aggressive, more debilitating treatment, you know.
Can you? We've probably asked this question 1,000 times, and I'm old enough to remember when there was a big fiasco about fluoridating the water, and there were political things against it, and political this and political that, and lots of legislative fights. What's the role in fluoride, and is there any role in oral cancer? Heavy fluoride helps, or what do we do here?
So as for cancer, I don't really know of any role that fluoride plays in cancer prevention or cancer causation. I've never heard anything about it causing or preventing it. As for your cavities, fluoride plays a huge role. Because fluoridated water, what it does is that fluoride ions in your water, when they get into your tooth, they change the composition of your teeth, actually, making them harder, which means that they actually raise the critical pH in your mouth, at what point they cause cavities. So if regularly your mouth gets cavities at a pH of 5.5. Let's say you reach that after a sugary beverage or chronic sugar intake. It actually lowers the pH, so making it, you have to drop the pH even more if you have fluoride ions in it by a whole pH down to 4.5. So having that fluoride in your teeth is highly protective against cavities.
Okay, vitamin C was heavily recommended for everything in the world, I guess, from fixing your tire. I'm wondering now about the chewable vitamin C as far as the acid media it puts in your mouth. Bad, good?
Just a chewable vitamin, I would have no problems with. You can go out and eat an orange if you want to. I mean, I eat orange. I had 2 yesterday for breakfast. So, it's not that it's, when you talk about cavities, the vitamin C is great for the gum tissue because it helps promote collagen building. But as for the acid, it's chronic acid exposure. So I have no problem with somebody, let's say, having a Coca-Cola or something like that during lunchtime or something. But if you're drinking six soft drinks, all containing 42 grams of sugar throughout the day, or sipping on, one of those iced coffees with a ton of sugar in it throughout the day, it's the chronic exposure, just like anything else related. It's chronic use. So somebody that has a pop every day for lunch, they rinse with water afterwards, they're probably fine. Somebody that drinks, 7 cans of pop throughout the day, they probably have a couple more cavities.
All right, Dr. Walsh, how about you share your contact information with our listeners and a summary of what you'd like to take away from today's show to be?
I can be reached at Cleveland Clinic Mercy Hospital. My phone number is 330-489-1278. I think the big takeaway is the HPV-related cancers are more common in men or males, so I think it's obvious why women should be vaccinated, or girls, to prevent cervical cancer, but it's just important for boys to be vaccinated. And actually, the cure rate with the HPV-related cancers is much better than the traditional smoking, drinking head and neck cancer. The 10-year survival is up to 80%. So it's a very treatable cancer, but it's also very preventable, and that should be the emphasis.
Okay. Dr. Pancake, how about your info? So for our listeners, before we wrap up.
Yeah, you can reach us here at the Dental Services Department at Cleveland Clinic Mercy Hospital. You can just Google us on your phone and give us a call. We do comprehensive treatment all throughout. Feel free to call in and schedule an appointment.
Thank you both.
We're very tight on time, guys. Thank you very much for our guest, Dr. Edward J. Walsh, MD, Medical Director of Cleveland Clinic Mercy Hospital Cancer Center, and Dr. Alex Pancake, DDS, with Cleveland Clinic Mercy Hospital Dental Services. We'd like to remind your listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, Genuine Appraisals and Liquidations, and of course our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here on WHBC next Friday.
The preceding program was sponsored by the Medicine Center Pharmacies.